has changed so much, perhaps nothing more pronounced than healthcare. Some health experts believe one big change in medicine could be here to stay now. Channel 3's Wendell Edwards is telling us what this means for you and the next time you need to see a doctor.
It was always there, but telehealth and the technology that supports it were hardly ever used until a global pandemic made it the only option.
Back in the spring when everything was shut down, we were almost at 100% telehealth.
Access to doctors, medical appointments, simply now are at your fingertips. National Patient Advocate Foundation Senior Director Caitlin Donovan says it is likely a permanent change because of the convenience.
The number one issue that people call the Patient Advocate Foundation for help with is actually transportation. It's a huge factor in a lot of Americans' lives and a big barrier for healthcare.
The benefits? Patients can be in their home or in any other setting. You don't need to have an existing relationship with the physician. And doctors are allowed to waive or reduce cost sharing for telehealth services. Robert Kosiar with Connecticut says even health insurance companies started making virtual visits more accessible. He says those insurance companies saw their value.
There is, but again, I think it all boils down to the need for it to be used appropriately.
For Kristen McJunkins, telehealth was everything. She works at Yale University and is a cancer survivor. For 8 months in this pandemic, it was the only way she saw her doctors. And now she says it just makes sense.
From a consumer standpoint, and if you can do a quick follow-up call so you don't have to take a full half day out of work or a whole day out of work, and then, doctors' offices are busy and, end up sitting there sometimes for an hour or so.
It's opened a new avenue for access to healthcare, in particular for the behavioral health side.
There was always really more demand than there was capacity to deliver those services.
We can't put the genie back in the bottle, and that's a genie we don't want back in the bottle because it allows people to get care more quickly, and it sometimes will allow them to get kind of a social services aspect to their care that was missing before.
A type of access that experts say will stay a part of our post-pandemic life. Wendell Edwards, Channel 3 Eyewitness News.